Sugarman here, not to be confused with your sugar daddy. I want to talk to you today about diabetes and teeth, your teeth. So why is looking after your teeth so important with diabetes, or why is looking after your diabetes so important to your teeth? Well, people with diabetes, particularly long-term diabetes, had it for longer than 10 years, type 2 diabetes in particular, you're at higher risk of tooth decay and gum disease, and or both. So I already remember it because I've got ginger hair. I remember it as gingivitis, the gum disease. So infections in the mouth, you probably weren't aware, infections in the mouth or regular infections with the gums or teeth can increase the risk of heart disease or heart problems. So looking after your teeth is really important in diabetes. So what are the symptoms? The symptoms are red, sore, or swollen, swollen or bleeding teeth, particularly when you're brushing them. So if they're bleeding a lot, and it's sore, very sensitive, then you've probably got an infection in your teeth. Dry mouth or dry tongue, that's a sign of infection as well, dryness. If you have a white film on your tongue, sticking tongue out, white film there, quite often if you've had a cold, a very, very bad cold or flu, you'll notice a white film there, signs of infection. Or on the gums, white film on the gums, or the cheeks, the inside of the cheeks there. So how do you reduce the risk of tooth decay or gum infections? Regular brushing, of course, looking after your teeth. Regular checkups. I can't emphasize enough just how important regular checkups with people with diabetes is with the dental or your dentist. Chewing sugarless gum to increase saliva if you do have a dry mouth or dry tongue, and keeping your blood glucose levels and HbA1c within a target range. Of course, by reducing the sugar levels or reducing the high sugar levels, reduces your risk factors, of course, in anything with diabetes, particularly with tooth decay and gum disease. So keeping your sugar levels between 4 and 8. Don't go above 8 too often. If you are, knock on your doctor's door and say, please, I need a review of my diabetes medications or my insulin. If your HbA1c result, that's your 3 monthly average that you might have done every year from your doctor, if that's above 7%, same again, you need to be knocking on the door. You need to be proactive about your diabetes, because the doctor isn't as aggressive or shouldn't be as aggressive with your diabetes control as you should be, because this is you, this is your life, this is your teeth, your heart and your organs. So you need to be proactive about your diabetes. You've been listening to the Sugarman. Thank you.